Hello.
I'm okay, I think.
From First Aid, Hervey Bay.
Yeah, okay.
We have been conducting first aid courses since 1985,
Don't move too much. Help's on the way, okay?
training approximately to date about 50,000 people in all levels of first aid.
I'm okay, I think.
Our senior instructor's profession of 3 decades as an ambulance officer paramedic and a background as a medic gives him the experience to examine some of the current topics in traditional first aid training. I would like to make a quick overview of topics taught in first aid courses.
Yeah, okay.
That may cause confusion to the public.
I'm okay.
I would like to emphasize these are only our opinions from our research and our experience. Let us cover some areas of possible contention in first aid training.
Do we always have to commence CPR if we find someone obviously deceased? For example, rigor mortis, injuries incompatible with life. The clear answer is no. If they are showing signs of obvious death, injuries incompatible with life, massive trauma, or it's too dangerous. These are some of the times that commencing CPR is not logical or reasonable. Just because a call taker tells you to start CPR, it does not mean you have to. They are not seeing what you are seeing. Their advice is scripted. If you are unsure, then start CPR if that is your choice.
The Australian Resuscitation Council clearly states if you are unwilling or unable, you do not have to do the breaths, even if a call taker directs you to. You do not have to the breaths, this is your choice. Training organizations are forced to teach breaths by various government bodies. However, the Australian Resuscitation clearly states you do not have to do them if you are unwilling or unable. In fact, most lay people will do the breaths poorly, by overventilating, especially with children, causing stomach distension, diaphragmatic splinting, and regurgitation. In addition, most people have no clear idea of the appropriate head tilt required, again causing more complications. Nor do they understand minimal volume resuscitation. I have noted that over 90% of courses, even with guidance and correction, participants normally do the breaths poorly. Perhaps with correct technique breaths may help with. There is evidence with children hypoxia and drowning. If the breaths are done correctly, they may benefit these conditions.
Scenario 1 danger is not present. The casualty is unconscious and breathing normally. Yes, they may have a spinal injury. However, if you do not carefully remove the helmet and manage their airway, they could drown on their own vomit or regurgitate. Their tongue will probably fall back and obstruct their airway. They could die from lack of oxygen and airway complications. If they are fully conscious, perhaps leaving the helmet on may be acceptable. They will probably ask you to take it off, or if they vomit, you need to get the helmet off.
They burn every time I blink.
Your eyes are full of a viscous fluid.
Better?
With a penetrating eye injury, lay them flat, or perhaps a very slight head elevation, to avoid loss of fluid. If you can fit an iPad or even a foam cup, use that. Now you may have been told to bandage both eyes.
This drop helps.
Why would you cover up the uninjured eye? That would cause more stress. And the eyes would actually move more in unison as you try to track sounds and voices because you cannot see.
Sore, but better.
If you had welder's flash in both eyes, cover both eyes with a cool, moist dressing.
Better? Still sore?
Some irritants, such as dust. Try to irrigate. Do not forget to try and get under the eyelids. If you have no luck with irrigation, consider it's hospital time.
They burn every time.
Avoid scratching the eye when handling them or causing further infection or inflammation.
Still sore, but better. They burn every time I blink. Hope this drop helps.
This is a very concerning term. Supposedly, if they are unconscious, altered level of consciousness, or cannot manage their own airway, vomiting, and they are breathing, we are supposed to place them in the recovery position. What does the word recovery position assume? They will recover. That may not be the case, giving loved ones a false hope. Its correct term is the lateral position. This is a very poor video as the head should be better managed. However, this is a common way this position is taught. Where is the spinal alignment? Where is the postural drainage?
Firstly, the chances of lay people doing the correct ventilations on a baby/infant without causing more harm is very low. There is almost a guarantee. They will cause gastric distension and active, as I saw present as a paramedic. Why? They do not have enough training and exposure, or the instructor has not done their research on pediatric resuscitation. In addition, if it is a family member panic and adrenaline, this will most likely cause excessive ventilations. In addition, many first aid instructors teach cover the mouth and nose. This may not be necessary or appropriate. Perhaps for a newborn. I will give you an example. How much breath do you give a 1-year-old? It's about 80 milliliters maximum. Now the air is going to the stomach. If you are not sure, do hands only CPR with a neutral head tilt? What is a neutral head tilt? This is another area of confusion. I guess a simple explanation is a sniffing air position. If you decide to do the breaths, perhaps just a very slight rise and fall of the chest could be a guide.
This is a major misconception. If you are doing CPR, keep going until help arrives. You become exhausted, life signs return. Paramedics arrive and take over. It becomes unsafe.
Australian snakes are a member of the Elapidae species. Research indicates that the pressure immobilization technique could save lives. The lymphatic system is a low-pressure pathway that works on muscle contraction and pulsation of nearby arteries. In other words, difficult as it is, avoid movement. The technique: stop activities such as walking, as muscle contraction and pulsation of nearby arteries. Move the venom through the pathway as previously mentioned, then move to the lymph nodes, then to the circulatory system. The application of a pressure immobilization bandage, applied correctly, will slow down the outflow of venom. Bandage from the toes to the groin, or the fingertips to the armpit. How much pressure? About 80 to 100 millimeters of mercury pressure, gentle but firm. Many people bandage way too tightly, causing circulation problems long term. Your best option is to buy the correct snake bite bandages. Does the bandage technique matter? Yes, it does. A simple spiral bandage technique is inadequate. It will fall down easily. In addition, it will have uneven low pressure spots. You need a reverse spiral technique. Why do you not go down then up the limb? This will cause venous distension and increase hydrostatic pressure. No medical professional ever needs to see the snake. It is done with a swab test at the hospital. Look for other bites on other limbs as well. Multiple strikes. Immobilize with splints or the other limb or the trunk of the body. This first aid will only work with elapids, not for crotalids or vipers. Why do most Australians not die from snake bite? Sheer luck. Most snakes dry bite. It is not normally from good first aid. Assume it is a wet bite and it is a taipan, until proven otherwise by the hospital. Do your pressure immobilization if you are not sure what they have been bitten by. The technique is used for venomous snake bite, funnel web spiders, cone shell, blue-ringed octopus. You are not sure why they have neurological symptoms post a bite of unknown unseen species.
I hope I have clarified some issues in first aid courses. Please contact me if I can assist or you want further clarification. Hope to see you on a course. From Glenn.